Yeah, although the mainstream um, doctors or medical opinions of doctors, um, mainstream medical opinions, they say insomnia is caused by depression and anxiety. That's the mainstream, but that is not necessarily the case. In my opinion, I believe that's false. That's a lie. That's bullshit. Um, I don't believe depression and anxiety is the cause of insomnia. I don't believe it, not even for a minute. Now, there is most people with depression and anxiety do have, I do believe most people with insomnia do have depression and anxiety. This is normal because the depression and anxiety could be caused by the insomnia itself, but it's not the root cause of the insomnia, right? So, but doctors, they want to push this because they don't have another solution other than give you psychiatric medications. They don't want to give you another solution like hormone treatment. You could go ask any doctor now, what's the solution? They will never tell you go to a hormone doctor, get tested, get hormone replacement. They don't do that. They don't want to do any more testing, like to see maybe you have a health problem that's causing it, right? So there's that kind of laziness of the doctor kind of prevents you from finding the real truth. What is going on? What's causing your insomnia? A lot of insomnias could be caused by a medical problem or by hormone imbalance, and not necessarily a depression anxiety cause. In my case, I believe it's not depression and anxiety. I believe it's something else because even if I'm having panic attack, like I mentioned before, um, I'm still even after I have my panic attack, I could still fall asleep after that sometimes, right? So this is an indication. Even when I'm anxious, so like not just panic attack, even sometimes when I'm having anxiety at nighttime, and I choose to bear the anxiety, and I still be able to sleep, right? Like last night, I was having a little anxiety. I felt I was very close to having a panic attack, but I still forced myself to stay in bed. I'm like, no, I'm not gonna get out of that bed. I'm gonna face the anxiety. Whatever anxiety I have, I'm gonna face it because if I get out of the bed, I'm gonna train my body to stay awake at night. So, like, there's a lot of things they teach you about insomnia. Maybe not true. I don't know. Like, I have to kind of experiment and see what works and what doesn't work. Some of it makes sense. Some of it doesn't make sense. Like for example, when they were doing the when the therapist was telling me um, the reason why you have to get out of bed if you're having some sort of anxiety is because you don't have anxiety in bed, okay? And you don't want to train your brain to associate bed with anxiety. um, Also, another reason is because you want to train your brain um, to associate bed with sleep only, right? But this is the issue also when you get out of the bed. When you get out of the bed, the issue is you train your brain that you need to stay awake at night, right? Although you may be training your brain to associate bed with sleep, but also you're associating night with being awake, right? Because there's no way you're gonna get out of bed and you're not gonna feel more awake than before, right? The moment you get out of the bed, you're increasing your heart rate, and when you're staying up, not laying down, your heart rate is higher, and when your heart rate is higher, you're more awake, you're more alert, right? So there is no way that stay moving out of the bed is gonna be make you more sleepy. Well, I mean, it might make some people more sleepy. It might, I don't know, but for me, it never worked. It never worked. I will stay up for 2 hours, 3 hours. I'll feel even more awake than before. So this is that. That's why it never worked for me. That concept, and I think it might have even make it worse for some reason. I don't know. So I could be wrong too. I don't know, but I'm just saying. Um, Sometimes our brain associate um, the experience outside of the bed. So if you get out of the bed and stay out for a go for a walk or do whatever activity, because that's what they advise you do, some activity, relaxing activity, go for a walk, drink a cup of milk, do some breathing exercises, read a book. They tell you all these things, right? But the issue is you're associating all these activities that they ask you to do when you can't sleep. You are training your brain because all these activities are associated with being awake. You don't read a book when you're sleeping. You read a book when you're awake. You don't walk when you're sleeping. You walk when you're awake. So you're training your brain to associate being awake with nighttime, right? So that's also the danger of that. So that's why that therapy may not work. That therapy may not work for some people, at least. It may work for some, may not work for others. But the reason why I think it may not work for other people like me is because your brain is associating being awake with nighttime. Yeah. So that's why it probably never worked for me, because every time I wake up, I get up from the bed, I try to do some activity like they suggest to me, like, read a book, do all these things. It will help you fall asleep. Um, every time I do that, I feel more anxious and I feel more panicky and I feel more awake. So I'm like, what's the point of doing that if it's making me feel all these things, right? So that's why I stopped doing that. Like, in fact, I force myself to stay in bed now. Even like last night. Last night I definitely was not sleeping that much because I'm always awake. I may have like 1 hour, every 1 hour I may sleep 5 minutes, 10 minutes, and then I wake up. 5, 10 minutes, I wake up, or maybe half an hour. I don't know. I don't know if it went to half an hour. It might have, but there's no way to accurately predict it, even with the use of a smartwatch. My smartwatch looked when I looked at my smartwatch graph, it looked messy. To be honest, it didn't look like I slept any minute. To be honest, um, although my smartwatch predicted I slept 8 hours, it says I have a good sleep, but I didn't sleep. I didn't. I slept. I know I slept, but I didn't sleep that good. I didn't sleep 8 hours for sure, 100%. Um, it looked messy because when you look at the graph of the smartwatch, it will say light sleep and then all of a sudden awake, and then light sleep, then awake, light sleep, then awake. That's not normal. A normal graph will look like REM, light sleep, deep sleep, REM, light sleep, deep sleep. You will see the cycle going up and down without much interruption, without much of waking up, right? That's a normal graph will look like. If you have that kind of normal graph, you have REM, deep sleep, light sleep, deep sleep, REM. It's just like you have this what do you call, um, like the graph how it goes like circle, like a dome shape, and then you have a trough, crest and trough. I don't know what they call them. I forgot. Um, so like when you have a graph like that consistently and not going too much of light sleep, like a straight line, light sleep shows as a straight line. If you have too much of a straight line, that is fake. That is not a sleep because that's not a normal pattern, right? That's not a normal pattern. You're not supposed to have too much of a light sleep. If you have too much of a light sleep, that means it's fake, right? You didn't sleep at all. If you have, if you don't have too much, if your REM sleep was only 1 minute or two, that's not REM sleep. That's fake. Okay, REM sleep is supposed to be a little longer. Um, You can't go like 1 minute and then 1 minute of REM and then all of a sudden you're awake. That's not REM. That's just fake. So I learned to read the graphs, how to read them more accurately, and I really don't think I slept a lot. Although I did sleep, but I don't know. I can't accurately predict how much. I cannot accurately predict how much. It says 8 hours of sleep, but I didn't get 8 hours. That's for sure. That's 100%. And even when I woke up, I didn't wake up drowsy. I didn't wake up like drowsiness is an indicator of good sleep quality, and if you don't have that, you didn't have good sleep quality, right? Um, and one thing the smartwatch is not accurate for, uh, like it gives you this benchmark, like to compare to other people. Now I don't understand. I don't know if anyone on YouTube could explain it to me if they have experience. Now I don't know understand how it compares it. Does it compare it to the same people as your profile? Like I'm using the Fitbit app. The Fitbit app um, is supposed to compare your sleep to other people. Now, is it comparing my sleep to other people in my profile or to other people in general, like all other people? I think it's maybe comparing my sleep to the people in my profile because the people in my profile, I'm supposed to be like a tortoise profile, like a slow sleeper. Um, so I'm thinking maybe it puts me in that profile, the kind of animal I am, like the sleep animal. It associates a sleep animal with my sleep behavior. So it's telling me that I sleep like a tortoise. Um, it's telling me I'm sleeping like that. This is my sleeping behavior. I'm a very slow sleeper. I keep waking up, right? So maybe it's comparing my sleep to to other people who are having the same sleep animal. I don't know for sure. But even then, I'm still one of the lowest. Um, one of the lowest in the deep sleep, right? I never reach, like I hardly reach the benchmark of other people, right? I Most of the time I don't reach the same benchmark in deep sleep as other people. My issue is I can't even sleep 4 hours straight. Even on my good days when I sleep for 4 hours, I don't sleep 4 hours straight. I will sleep like 1 hour, half an hour, 1 hour max maybe, and then wake up. And then after I wake up, I stay awake for a few hours, then go back to sleep. And this is how I get 4 hours of sleep. Over like if I stay in bed 8 hours, I may get 4 hours eventually. Um, and that's on my good days, like when I do get sleep, right? Like I wish I could sleep 4 hours straight. Like it's just hardly. It's very hard even to do that. Um, it's challenging. Um, what I was going to talk about. Um, yeah, so I was going to talk about how it's hormone is definitely one of the things that should be investigated when it comes to sleep issues. Now, how do I know hormone is a major factor also? Um, like pregnant women, like my wife is pregnant. Um, she's pregnant and she could sleep very well, very, very well. She even told me that after she got pregnant, she's able to sleep better. She's able to sleep better than when she wasn't pregnant. And I could see that too myself, right? Like yesterday I see her sleep in the day, and then she sleeps at night. She takes a lot of naps in the day. And like yesterday I saw her sleeping for almost 2 hours in the day, right? And then at nighttime she fall asleep very quickly, like within 5 minutes. And then she's snoring and I'm still awake. I could hear her snoring. Um, I see her sleep the full 8 hours at night, or more than 8 hours. Sometimes she goes to bed at 8 or 9 p.m., and she sleep until 8 a.m., which is she sleeps like 12 hours at night and takes 2 hours to 3 hours naps in the day. Like she's always sleeping, right? This is an indication that hormone do play a major role, like because yeah, do play a major role in hormones do play a major role in sleep. Um, Pregnant women, they go through hormonal changes, right? And that's the reason why she's able to sleep very good. Um, this proves the theory that hormone do play a role. This just does prove the theory that hormones have an impact on sleep. Then how do you explain, if hormones don't play a major role, then how do you explain pregnant women can sleep way more than a woman who's not pregnant, right? Diet as well could affect sleep, I think. um, Diet, but I still have to investigate different diets to see which diet will help me the best. Now, my wife is saying that when she doesn't eat, she feel more sleepy. I don't know. For me, it was the opposite. Like when I'm fasting, sometimes I feel more anxious, um, and I cannot fall asleep. So, but that doesn't mean I have to fast. Maybe I have to delay my eating behavior. Like, for example, maybe I should have a late time on eating breakfast. Maybe I should not eat very close to bedtime. Um, so I don't know. I have to try different diets to see which one works best. Um, I know for me, eating before bedtime can help me to become sleepy sometimes, but it may not be good. I don't know. So I have to try. I have to try different things. For me, eating can help me sleep, right? But eating too much could do the opposite. Also, it could make me feel more awake. So maybe a small snack before bed can probably be good for me. I don't know. I'll have to experiment on different things and see what works and what doesn't work. Um, the idea is to kind of do certain things to change your behavior in a certain way, eat certain things that will work in your favor in terms of balancing your hormones. That's the idea. That's what I should try to figure out. Since I cannot get any hormone replacement or any hormone therapy, my only option left here is to try different behaviors or different diets to kind of alter my hormones uh, in a favorable way to fix my hormone levels balance. Now, I can't fix every hormone level, but the only thing maybe I can control is the cortisol level. We know cortisol level goes high in the morning, and at night time is supposed to get reduced. But for people with insomnia, it may be the opposite. Maybe at nighttime your cortisol level goes low. Might be. I don't know for sure because there's no way for me to test it to find out. Right? What might be happening is sometimes at nighttime your cortisol level may go low. It may work the opposite way compared to normal people, right? Normal people will have their cortisol drop at night, right? And rise in the morning. That's for normal people. For us, instead of dropping low at night, sorry, yeah. So I think I got confused there. Yeah. So normal people cortisol level go down at night. When the cortisol level go low at night, they're able to sleep better. And then when their cortisol level rise in the morning, then they will wake up. The cortisol makes them wake up. High level of cortisol. For us, it may be the opposite, right? And there's no way for us to test it. There is no way to find out whether our cortisol working normally or not, like normal people. It might be not. Like Maybe our cortisol level in the morning becomes low. That's what I'm thinking. Maybe it's happening, and at nighttime maybe it's increasing for us, for people with insomnia. That's why at nighttime we cannot fall asleep because our cortisol level is very high. So I have to find a way to reduce the cortisol level at night and make it rise in the morning, right? So one way to make the cortisol rise in the morning is to not eat. Actually, I think maybe I should try that. I don't know, because eating may reduce the cortisol level, right? So I want my brain to associate morning with, basically, that's the idea. I want my brain to associate morning time with high cortisol level and nighttime with low cortisol level. Once I do that, that will probably reset a little bit some of my hormone levels, at least cortisol wise. So I want to do certain things in the morning that will make my cortisol level rise. Could be maybe exercise, and exercise will not really make it. It might make it rise and then drop, because when you're anything you do like intense activity, physical activity, it will make adrenaline go up and probably cortisol as well. Initially it will make it rise, but eventually it will drop down because you have your brain is also making other relaxing hormones as well, right? Like serotonin and all these things, um, dopamine, right? So I don't know if exercise will be one of them that's supposed to spike my cortisol level, but I know if I don't eat in the morning, that might be a good way to start my day, right? So probably not eat will be a good idea, and just make my cortisol go high, very high, like put myself through a lot of stress in the morning. Maybe a little exercise. Maybe I'll try. I'll have to. The only way I could find out is by experimenting. I don't know. I don't know for sure, but I have to make sure. I don't know. I think for me it does rise my cortisol level because my smartwatch, after I eat, it shows my heart rate is high. Like when I get up from the bed and I go eat, at that time my heart rate is like 120. So if my heart rate is that high, most likely my cortisol is already high in the morning. It goes high in the morning. So maybe it's normal, my cortisol level, right? Within normal, maybe. So cortisol may not necessarily be a problem for me, right? It may not be, but for some people it might also. I don't know. There's no sure way to tell unless you do some testing, right? To get a hormone doctor or endocrinologist to test your levels for you at different times of the day. And I don't think anyone will do that. This is the problem. Um, yeah, cortisol is one way, but other hormones, I don't know. Maybe through diet somehow. Like I know growth hormone maybe through workout, but the problem with workout for me, it increases my fight or flight responses, right? So this is the problem with workout. I know workout increases growth hormones, but it also increases my fight or flight responses, the sympathetic responses, which is not good for sleep, which makes sleep sometimes worse, right? So this is where I'm trapped in. Like the good things that are supposed to help me improve some of my hormones, some of my good hormones, like the growth hormones, can also make other hormones, bad hormones, to increase as well. So, like workout is good for growth hormone, is good for sleep. Also, like it does improve some of the good hormones that help you sleep. But at the same time, it also makes other bad hormones to rise, um, like cortisol level, fight or flight, right? Sympathetic stimulation. There's no way you'll be able to rest and digest parasympathetic stimulation of your nervous system if you're working out. Working out is not rest and digest, okay? So the only way to increase your parasympathetic stimulations of your nervous system is by resting and digesting. Like it says, rest and digest. You eat, you sleep, right? You lay down in bed. And that kind of behavior might actually, if you do a lot of resting and digesting, you might be doing a lot of stimulation of the parasympathetic nervous system, which will eventually might help you improve your sleep, right? Now, working out is not a parasympathetic activity, right? Deep breathing is a parasympathetic activity. Deep breathing, meditation, maybe taking a shower, right? Like maybe watching a movie could be a parasympathetic as well, like relaxing to the body, right? All these. So basically, the idea is to increase that um, parasympathetic nervous system stimulation. All right, doing these activities that will improve the parasympathetic activities in your life, in your daily activities. Um, you want to have more parasympathetic than sympathetic, right? Behaviors, um, and that's my logic at least. We need to do have more parasympathetic than sympathetic to fix the sleep problem, because sleep issue is caused mostly because your nervous system is always in a fight or flight situation, you know, and it doesn't know how to calm down. Your nervous system doesn't know how to calm down, so it's always in a fight or flight. And sometimes working out and other activities that increase the sympathetic nervous system stimulation can indeed make it worse. All right. So that's why we have to be careful. I mean, even though a lot of therapists tell you go work out, do all these things, get yourself tired, but it may not actually work. It may not work. It might work for some people, but not for everybody, right? Because as I said before, although working out has some benefits in improving some of the good hormones, but also it has other harms where it can make the bad hormones go higher, like cortisol levels. Um, you know, so it can rise your cortisol level. It can stimulate, causes a sympathetic nervous system stimulation, right? And it's not a rest and digest behavior, right? Because when we work out, it's like we're running, right? You're running from danger. That's a sympathetic response. That's a sympathetic behavior. You're increasing that stress level, right? And stress can improve on some of the good hormones. I'm not saying no. It can improve on your growth hormones. It can improve on, right, which is good for sleep. But again, it depends on your body how it handles the stress. If your body isn't exhausted and it cannot handle stress efficiently, most likely this is the workout is going to make it worse. But if your body can handle stress efficiently, workout may not make it that bad. It may be more good than bad, depending on your body actually. So that you have to experiment with that. For me, it didn't work. It made it worse. Like the day I work out, I end up going to the hospital because it's like it becomes very hard for my heart to go down. Like once it goes up, like during workout, it takes a long time for my heart to calm down. So that this is an indicator that my body is not handling stress efficiently, right? If it's taking that much long time for my heart to rest, it's not handling stress efficiently. So, and what I'm trying to say here is like sometimes it's like when your body becomes so much exhausted, any small stressor will make you even more prone to be sensitive to stress, right? I don't know how to explain this again. Trying to make sense of it. Like before insomnia, before I had insomnia, small stress my body can handle it easily, right? My body can ignores it, basically ignores it. It doesn't pay attention to it, right? Like if someone pisses me off, swear at me, or disrespect me, I don't really care. I try to forget it. Within 5 minutes, I'm cool down. I'm okay. Maybe at the first few 5 minutes, it will make my heart rate to go up, right? When someone disrespect me, or you know what I mean, and it might make my heart rate go up for the first 1 minute or two, and then I calm down. But when I'm having insomnia, if somebody disrespect me at work or wherever I am, piss me off, right? I become easily agitated. Like the stress will stay with me for a long time. It doesn't disappear within 5 minutes or 1 minute. It stays with me all day long. So all day long, I'm feeling agitated because of what somebody said to me, right? So my body becomes very. The lack of sleep makes your body not efficient at dealing with stress, right? And that's what it is. It makes you very sensitive to stress, very sensitive to anxiety. Like the things that are not supposed to make you anxious makes you anxious, right? The things that are not supposed to make you that much stressed, they make you too much stressed, right? Yeah, the things that are not supposed to make you that much anxious make you a lot, cause a lot of anxiety, right? Like you will notice yourself, you're not very good at handling stress and anxiety when you have insomnia. Your body is too much exhausted, so it cannot handle any burden, anything that will burden it, like any small anxiety, any small stress. It will just mess up the entire day, right? And if you feel stressed all day because of small incident happened to you on that day, you cannot sleep. If someone disrespected you on that day, you probably cannot sleep because of that. Yeah, you become like a person with like, as I said, this is like a hormonal issue. It becomes like it's an indication that it's a hormone issue. It's like a woman on a period, right? When she has her period, small thing can piss her off, right? Um, and same thing with a person with insomnia. It's like a small thing will piss you off, and you could tell this is a hormone issue. You could tell because of the hormone imbalance, you're feeling this way too. Your body cannot handle stress very efficiently, stress and anxiety. Um, and that's an indicator of a hormone imbalance. Um, so like that's why you have to kind of take times off and rest. Don't go to work maybe for a few weeks, for few months if you can. um, just remove all stressors from your life. You want your body to be in a rest and digest, right? Condition. um, you have to place your body in that mode, rest and digest, most of the time at least, and avoid any stressful situation, any situation that will make you anxious. Avoid it all, and you just want to rest and digest. um, and hopefully that will probably balance some of the hormones. And I don't know for sure, but maybe eventually if I tried everything and nothing worked, I probably still have to take psychiatric medications. That's my last resort. Like I don't have anything else to try. I may have to, to take psychiatric medications that will make my panic attack worse, and that will cause me panic attacks every day. um, but if it helps me fix the sleep problem, it's okay. I'll have to handle the panic attack, I guess. I have no other choice. I can't live like this forever, like not sleeping. I can't. Like I'm breaking down, you know. I'm breaking down. Um, I noticed something. I don't know what's happened. Like this morning when I woke up, Before I ate, I had no burning sensation, but once I start to eat, I start to feeling burning sensation. Now, I don't know if this is a cortisol thing or some other hormone. I don't know. Like burning sensation in my chest after I ate. I don't know why. Like I don't know. This is probably, it feels like cortisol. I don't know. Maybe it's cortisol. Like I don't know how to explain that feeling. It's like, yeah, it's like a a stress chemical. I don't know. It feels like it because it feel like somebody punched you in the face and you're shaking and shivering due to that feeling you get in your chest, right? Like butterfly, you could say, butterfly and burning. I don't know. I can't explain it well. I really cannot explain how I'm feeling, but I'm getting this feeling after I eat. Um, I'm thinking it's cortisol. I don't know. I don't know. I don't know for sure. Something is rising up. Something is happening after I eat. Like this morning, something is increasing this anxiety and stress. So I don't know for sure what it is. Yeah, the important thing is we have to try to rest, do a lot of resting. Food, I don't know, food may be affecting also my mood somewhat. Yeah, like I can't explain what's this burning sensation. So it could be affecting some hormone somehow. Like without help from medical doctors to help me find out what are my hormones doing in my body, what are my hormone levels. I don't know, like it's very hard to figure things out on your own, right? Unfortunately, they don't care about us. Would be like doctors don't care about people with insomnia. That's the problem. Like I hope one day they they really take us seriously, like, because this is insomnia. It's not a joke. Insomnia, they shouldn't take it like a joke, like or a person with mental illness and brush us on the side. Oh, he's just a mentally retarded guy. You know, that's how they take us. He's just a mental issue. I cannot fix him. And if he's not taking his psych medications, I don't care about him. Right? We shouldn't be treated like that. We should be treated better than that. Um, this is not the way you treat someone with insomnia. Right? Um, and doctors should be educated about this. They should be educated that psych medications don't work on everybody. This is number one. And don't treat every person with insomnia as a mental patient, because that may not be the truth. Maybe something other underlying causes of the insomnia. There's other underlying causes, not always depression and anxiety. And this is what I'm trying to bring bring awareness about. Insomnia is not always depression, caused by depression and anxiety. And believe it or not, most of the time it is a hormonal issue. It's a hormone issue that was that your body is not able to balance, or caused by some physiological problems like a liver problem or other problems. Could be cancer, right? I don't know for sure if I have cancer or a liver problem. I don't know for sure because they don't do proper testing. I cannot figure out what's causing it. It could be a hormone, it could be a liver problem, it could be cancer, it could be anything else. I don't know for sure. I'm hoping it's hormone. I'm hoping it's not that major. I'm hoping it's not a liver problem because I do have a history of liver failure, a family history of liver failures. So this is why I'm worried now. Um, I like insomnia could cause liver failure itself. Now, if I don't have liver problem, I might end up having liver problem because of the insomnia. Um, Even though I may not have heart problems, but I might eventually end up having heart problems because of the insomnia, right? I might have physiological issues because of the insomnia, which might make my insomnia even more worst, right? Um, so I need to kind of get the problem fixed as soon as I can. Like I cannot delay it anymore. I cannot delay it anymore. Like I have to put an end to it, um, as soon as possible. It's already been 1 year. How much more I have to suffer? Uh, I can't suffer more than this. It's 1 year already. I suffered sleep problem for so many years, but 1 year is really bad. Like I can't even get 4 hours straight of sleep. For 1 year, I've been living like this. Not, I couldn't even get 4 hours of sleep, like continuous 4 hours. No, and even when I do get 4 hours, as I said before, I only get like I only sleep like 1 hour and wake up half an hour, wake up and then go back to sleep. Like this is not proper way to sleep. This is not a proper way to sleep. At least I should work on getting 4 hours straight, 4 hours of good sleep straight, like without interruption. If I could do that, that would be success. That should be my initial goal. 4 hours of sleep, no interruption, no waking up in the middle of the night. At least that would be like meeting my goal, my short-term goal of fixing this issue. My long-term goal is to have 8 hours of sleep a day, no interruption, no waking up in the middle of the night, none of that stuff. Um, but our healthcare system, they really need to take us seriously, like I said, um, because we're gonna end up causing more problems for them. We're gonna end up costing more money for the taxpayers because um, if insomnia is not fixed, you're gonna end up having physiological problems like liver failure, heart failure, kidney failure, and that will be a burden on the hospitals. That will be burden on our healthcare system. That will be burden on the taxpayers' money, right? Um, right now, they're refusing to help us because they don't want to do any testing to cost the taxpayer money. That doesn't make sense. They don't want to use the taxpayer money to help us because they were saying, "Oh, we're mental patients." They don't want to waste money on us, right? To do any more testing. They're convinced that our issue is mental, so they don't want to waste any resources. Like even I remember my psychiatrist consultant, they're telling me not to go to the hospital. They're pushing me not to go, not to even see different doctors, right? Like, don't see different doctors, don't go hospital, don't do this, right? They don't want you to use the resources. You're wasting they blame you for wasting resources. This is how ridiculous it is. They're like, oh, you're wasting our resources. You're going to the hospital too much, too often. You shouldn't be doing that. Like, that's how they treat us. This is disrespectful, I think. I don't know. I think I felt disrespected, at least. And from my point of view, I felt disrespected. Um, I know they have a point. Like they don't want us to use resources and whatnot. Then fix it, because eventually I'm gonna be using your resources if you don't fix my problem. If you don't care about my problem, I'm gonna be using your resources. You don't want me to use your resources, hospitals, paramedics, whatever, seeing different doctors, then fix it. How easy is that? You fix it, you take care of it now, so it doesn't become a problem later. If you fix it now, I don't need to end up being a heart patient or a liver patient, right? A patient with a liver problem or heart problem or kidney problems or diabetic problems, right? I don't need to become that kind of patient, and I don't need to waste your resources a few years down the line. But if you don't fix it now, I'm going to be wasting even more resources than if you just dealt with it. It's all about prevention. And this is what you have to care about, is preventing health problems. As a healthcare professional, you should prevent health problems. That should be a priority. Not not focus on, well, if I do more testing, I'm going to be wasting uh, taxpayer money. That's not the right attitude. If I do more testing on this guy and he has mental issues, then I'm wasting taxpayers' money, right? That's how they think of it. And I don't want to do that. But you're wrong. You are 100% wrong, because the issue may not even be depression. You have the first thing before you decide to The first thing, before you decide to accuse somebody of being mental patient, you have to rule out, before even you prescribe any psychiatric medications. As a doctor, as a good doctor, I would say, my opinion, as a good doctor, you should never prescribe any psychiatric medications without first ruling out physiological issues. That's the number one thing you have to do. If you don't rule out any physiological issues, hormonal imbalance, physiological issues, if you don't rule that out first, and you give psychiatric medication, then you're a dumb doctor, in my opinion. I don't care what you think of me. I think you're a dumb doctor. You're a stupid doctor. Because the first thing, as a good doctor, you should do is investigate. Investigate, investigate, and investigate. Do test after test after test. I don't care if you have to do a full body scan, not CT, MRI scan. I don't care if you have to do that. Just do every test you can do just to rule out any issue. There is no issue, then you could say, okay, he has physiologically, he's okay. Hormonally, he's okay. The only thing is left is what? Is mental depression, whatnot. And then, yes, you could, at that time, definitely could say, well, he has no issue physiologically. This guy has no issue physiologically, no issue with hormones, no issue with anything else. We rule that out by doing some testing. Then the only issue that's causing his sleep is probably stress and anxiety, right? And like, if a doctor does all these things before accusing me of being a mental patient, being depressed and anxious, I would have probably believed him more, right? I would have accepted his explanation. But I'm trying to tell these doctors, I'm not gonna mention name here. I'm trying to tell these doctors, like, I didn't have any traumatic event that has caused my insomnia. I didn't have any new stress came into my life that caused my insomnia. I'm not thinking about it at night. I'm not worried about anything at night. Nothing. I'm not worried about money. I'm not worried about, nobody died, passed away. I didn't get divorced. Like, there was nothing new that came in my life that I could blame it on stress and anxiety. Nothing. And you're telling me it's stress and anxiety that's causing my insomnia. So how do you explain that? You're just making assumptions, but you have nothing to back up your assumptions, right? There is nothing. No, it's like, no, trust me. Like, this is what he's telling me, the doctor. No, trust me. A lot of the insomnia is caused by stress and anxiety. And most likely it is you're experiencing stress and anxiety. But explain to me, what am I stressed about? What am I anxious about? Nothing. Now, I do have anxiety and stress now because of the sleep problem, but it was not the root cause. When you fix a problem, you always have to look at the root cause, right? That's not the root cause. You have to investigate the root cause, right? Every person with insomnia is going to have stress anxiety, that's for sure, because you don't sleep, you're depressed, you're anxious, right? That's for sure. I'm not saying that's not true. I'm saying it's true, but it's not the root cause. And when you fix any health problem, you always have to look at the root cause of the problem, not the effect of the problem, the root cause, not the side effect, right? Stress anxiety is a side effect of insomnia, right? Right. It's not the root cause. It's a side effect. It's caused by the insomnia. Yeah. So, and I know, like, I still have to treat the anxiety and depression caused by the insomnia. I know that it might help me with the insomnia as well. It might help fix it, but if there's other underlying causes, even if you remove the stress and anxiety, even if you fix that, it's still not going to fix the issue because you didn't investigate the underlying causes, right? It could be a health problem. It could be a liver problem. It could be a heart problem that's causing it could be a cancer, right? That's causing my insomnia. So even if you fix the depression part of it and the anxiety part of it, it's still not fixing the problem completely, right? And if the psych medications are the only solution for the fixing depression and anxiety, and it doesn't work on majority of people, then how are you going to fix the depression and anxiety, right? It doesn't make sense also. You should give me the alternative treatment, hormone replacement. If not hormone replacement, you should put me on medical leave. And my doctor was refusing to give me a medical leave at some point. I had to beg him. He's like, no, no, I can't give you more than 2 weeks. I'm like, what's 2 weeks? It's nothing. I need to be on medical leave for a few months, not 2 weeks, right? So like that was a challenge for me because my family doctor was giving me a hard time, even giving me more than 2 weeks medical leave, right? So they don't take it seriously. That's the thing. That's what I noticed after I started experiencing insomnia. I noticed that doctors don't care, uh, doing anything else except giving you psychiatric medications, which may work and may not even work. Majority of them don't even work on majority of the patients. Um, but they have to give you the alternative. The alternative treatment will be medical leave, very long medical leave, or some short-term disability. And the second solution will be hormone replacement therapy, hospitalization. That might help, right? Um, so they have to give you the alternative, right? The alternative treatment beside just pushing psychiatric medications on you.